Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have real power, real control, and so that you can influence decision making even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in this week's episode I want to answer another one of the most frequently asked questions that we get from our readers, and the question is: how long is my loved one going to stay in intensive care with pneumonia? First of all, I'm really surprised by how many people visit the IntensiveCareHotline.com website for advice, insights and support. I really appreciate you coming to our website, and I will try and respond to as many of your questions as possible. You can send questions to support@intensivecarehotline.com. You can, of course, also visit our blog section on our website for more advice, tips and insights if your loved one is critically ill in intensive care. Now, I'm coming to answer your question of how long is my loved one going to stay in intensive care with pneumonia? The answer to that question is, of course, as like with many other questions, it depends. Let me shed some light on what it depends on. If your critically ill loved one is coming to intensive care with pneumonia as the primary cause of the intensive care admission, then it depends on the severity of the pneumonia. For example, in most cases the pneumonia is caused by an infection from either bacteria, which is a bacterial pneumonia, or from a virus, which is a viral pneumonia. For more information about the clinical picture pneumonia, including signs and symptoms, you can click on this link here that gets you to our page about pneumonia. Pneumonia usually goes hand in hand with seeing some changes on the chest X-ray, insufficient oxygenation and an elevated temperature or a fever. In normal circumstances, your loved one would be getting treatment with antibiotic or antiviral medicine. Depending on the severity of the pneumonia, your critically ill loved one might require intermittent BiPAP or non-invasive mask ventilation as a starting point. BiPAP ventilation is usually difficult to tolerate as your loved one is normally awake and the pressure required for adequate ventilation is quite high and causes discomfort. It can also be very effective in treating the pneumonia if your loved one can tolerate the BiPAP ventilation, because the pressure delivered can open previously closed or blocked sections of the lung that improve oxygenation. If BiPAP or mask ventilation is insufficient to treat the pneumonia, usually the next step is to start invasively ventilating your critically ill loved one. This requires a tube in your loved one's throat that's connected to a mechanical ventilator. The tube and the ventilator also require for your loved one to be induced to a coma so that your loved one is actually able to tolerate the ventilation therapy. Now you can find a link here to a blog post, what is an induced coma and why is my critically ill loved one in an induced coma, and you will get some explanations there. In either case, the goal is to improve the inadequate and insufficient oxygenation that brought your loved one to intensive care in the first place. If your critically ill loved one requires intermittent BiPAP or mask ventilation, and if the antibiotic therapy and or antiviral therapy is working, your loved one should be out of intensive care within a couple of days or 4 days at the most. If your critically ill loved one has been placed in an induced coma and is now mechanically ventilated with a tube in their throat, he or she will be in ICU for more than a couple of days. It depends how quickly the ventilation therapy and the antibiotic or antiviral therapy is working and how effective they are. Generally speaking, mechanical ventilation and the induced coma prolong your loved one's stay in intensive care, and you should expect your loved one to be in intensive care for at least 1 week if no complications occur. Also, if your loved one has been admitted to intensive care for other reason and has been placed in an induced coma, is on a ventilator and is critically ill, one of the side effects of the critical illness is often immobility, meaning that your loved one is bedbound. The immobility and the ventilation can increase the risk of your loved one developing pneumonia due to the lungs' restricted ability to become fully expanded. If the lungs cannot be fully expanded, the risk of developing pneumonia is increased, and especially secretions and sputum in the lungs can then develop into an infection. In those circumstances, the pneumonia is a complication on top of the primary reason for admission. Treatment is similar to what I described above. However, your loved one's length of stay in intensive care depends on other medical issues as well. Never forget that irrespective of what the intensive care team is telling you, that you should do your own research. It is therefore absolutely critical that you, as your critically ill loved one's immediate family member or friend, directly influence decision making by having control, power and influence. You'll get immediate control, power and influence if you download your free Instant Impact Report now. In the free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In this free report, you will also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get crucial behind the scenes insight so that you understand what is really happening in intensive care, how you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact Report, you'll also get 4 other free reports, and the reports you will be receiving are the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you're not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you very much for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our blog section, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again in another update next week.